Now, on to more serious issues, we every day we hear about all the deaths of coronavirus, and I must admit, I don't fully understand as to why we had 59 deaths overnight, but only 9 of them actually occurred overnight. 50, I think it's due to double counting or something. Or anyway, but the bulk of the deaths are continually occurring in an aged care setting. Now, to get a better understanding about what's actually going on, we're now going to speak to a doctor who has worked extensively in aged care, Dr. Mark Hobart. Good afternoon.
Good afternoon, Tom.
So what have you been doing in the last few months in aged care? Have you been just providing GP-type services to residents of various facilities?
That's right. What happened to change things fairly dramatically for me was an aged care facility right next to where I work had a coronavirus outbreak. And now there are, I think, 41 patients and 38 staff who have coronavirus.
Well, gee, that'd be one of the more significant outbreaks then, wouldn't it?
Yes, well, that's right. So the nursing home has gone into what's called a lockdown, and half of the nursing home is the coronavirus wing, and the other half is the, it's called the green zone. So you've got the red zone coronavirus, green zone
right.
non-coronavirus.
And have you continued to go in there and work even after all the positive coronavirus cases?
Well, that's right. I'm the, as I understand it, the only doctor that is actually physically attending the nursing home. I was called out of desperation by one of the nurses there because she didn't have anyone who would be able to sign, I know this sounds a bit gruesome, more birth certificates.
Oh, yeah, right, okay.
So I had to, so I said, yes, well, that's a basic thing that, people should have. And I wasn't too worried about, I'm reasonably young and fit. I wasn't particularly worried about contracting coronavirus. So I went in, and as it turns out, I've taken over the care of most of the coronavirus patients there.
Okay. And what have you observed about in general from this time in the nursing home with the big coronavirus outbreak? What have you observed or noted about the handling of the pandemic?
Okay. Well, the first thing to know is that patients, by and large, in fact, all the ones I've seen, have, even though they're corona positive, don't have signs or symptoms of respiratory infection or disease. Basically, they're just the same patients. They're suffering from dementia, stroke, and the other things that put people into nursing homes. What's different is that they are now all in solitary confinement. They are unable to, they don't eat in the tea room anymore. They don't have any social activities. They are all in their individual rooms. Also, the families can't visit them, so they have no contact with their families except basically, it's a tragic thing to see them talking through the windows.
So, I mean, that's got to be very, very hard on these elderly residents.
Yes, and their families too. Yes, and it's very sad. This has been going on for sometimes up to 3 or 4 months, I believe.
And do you think that sort of isolation is necessary?
Now, that's a good question. There are high transmission rates in the nursing homes. However, as I said before, there's not much evidence of respiratory infections or that sort of thing. I'm just wondering if this lockdown has gone way too far. And there should be some easing up here to allow basic family visits and things like that. I mean, even GPs are frightened to visit the nursing home.
Well, I mean, the person really with the power to do this, weirdly, is not the Premier, but right now, because we live under a state of emergency, it's the Chief Health Officer, Brett Sutton. How would you rate his handling of the pandemic, and what advice would you give him?
Okay, well, I think you mentioned the 59 coronavirus deaths, and they've been somehow brought up over previous weeks or something to come to this total. Now, I think what's happening there, a lot of people are dying in nursing homes with coronavirus, but not from coronavirus.
Really? Because I've wondered about that. I mean, it's been rumoured that, if someone has a positive diagnosis and dies, it's just easier to say, well, they've died of coronavirus rather than bothering to say or find out what else they might have died of.
Well, in fact, Dr. Sutton said that publicly in his press conference last week. He said people who die with coronavirus will be put down as a coronavirus death. He said that publicly in his press conference.
So is what you're saying is that a lot of these people were, sadly, but this happens in aged care, were dying anyway, and we're sort of treating the deaths differently because it's been, saying it's of coronavirus as opposed to just with it?
Yes. Well, this is obvious because what Dr. Sutton said last week. Now, I had a patient who died with coronavirus in the nursing home a week ago, a bit over a week ago. She died of a blood clot in her leg, but she happened to be positive for coronavirus.
So does that mean her death counts in the coronavirus total, even though she died of a blood clot in the leg?
Yes, it will be put down as a coronavirus death, as according to Dr. Sutton.
But does the having both the blood clot and coronavirus at the same time, does the coronavirus, did it in any way accelerate her death?
No, she had no symptoms. I saw her when she arrived from hospital after they managed her blood clot, and she was no respiratory symptoms whatsoever. No respiratory symptoms.
So what you're saying is that a lot of the deaths that we're reporting are not from coronavirus, but with coronavirus. Does that mean, again, this is in your medical opinion, we are overstating the severity of the disease?
Yes, I'd have to say yes, absolutely. I can't tell you exactly the percentage of people who are dying with coronavirus as opposed to from coronavirus, but I would think, from my observation in the nursing home, that the majority will be dying with coronavirus, not from coronavirus. And from the experience I've had in the nursing home I'm looking after now with 41 cases.
Well, that is fascinating. Look, I really appreciate your time and your expertise. Dr. Mark Hobart there is a GP, as you said, working in a nursing home that's had quite a substantial outbreak. Again, I'm not a medical expert. He is, or he's a doctor. But he says, a large proportion of the people reported as dying of coronavirus are dying with it. And remember, when people are in their 80s and 90s, they can suffer from all sorts of things. It's unfortunately, part of the end of human life that people accumulate diseases, and it's often quite difficult to say exactly what they die of because they might have what they call comorbidities. But if he's right, and that a lot of people who die were being told it's of coronavirus, but instead it's with it, then arguably we are overstating the problem. Anyway, food for thought, especially for Professor Brett Sutton, the Chief Health Officer.